Welcome to the We Talk Health Podcast, the official podcast for West Tennessee Healthcare. Please be advised that this podcast is not intended to replace any medical advice. Always follow your medical professional's advice and direction. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions, please reach out to us at wetalkhealthpodcast@gmail.com, and we will do our best to answer any questions you may have.
Welcome to another episode of We Talk Health. My name is Kwasigroh, and joining me in the studio today is Elizabeth Courtner. She has a BS in Communication Arts from Union University, and she is the Community Liaison for Healthier Beginnings, which is part of West Tennessee Healthcare. Elizabeth, how's it going? How are you?
It's good. How are you today?
I am good. Thanks for coming in today.
Yeah.
So today we're going to be talking about ACEs. Am I saying that correctly?
That's
Like
right.
ACE, like a card?
ACE. Mm-hmm.
Okay. So we'll kind of dive into what that is, what that means, talk about that in a second. First, I want you to just tell me about yourself. Tell me who you are, what you like to do, what you do here for West Tennessee Healthcare.
Yeah.
Just tell me about yourself.
So I've been working for about 2.5 years for West Tennessee Healthcare.
Okay.
Meeting in the community with families. Basically, anybody who has first-time pregnancy or a newborn, we kind of get them into our program, get them started, and meet with them weekly to kind of get to know them a little bit, help them through milestones.
Okay. Amazing.
Yeah, different kind of things that they can kind of help their child grow. We are definitely on the preventative side, so we don't want to see them get to a CPS situation. We don't want, DCS to have to come in, take their child away.
Sure.
So it's just on the preventative side so that we can kind of help them as they're growing and learning. Usually it's a teen mom or somebody who has not had experience with kids.
Okay.
10 care patients, that kind of thing.
Awesome. I mentioned that we're talking about ACEs. What exactly are ACEs and why do they matter?
So ACE, or ACE, stands for an adverse childhood experience. They're potentially traumatic events that occur in childhood, usually ages 0 to 17. A few examples of an ACE are somebody who experiences violence, abuse, or neglect in the home.
Okay.
Sometimes they witness violence in the community. They can have a parent that were separated or divorced. They live with someone who was mentally ill. They use illegal drugs, or sometimes they abuse prescription drugs, something like that, and they had a family member attempt or die by suicide.
Wow, that sounds like it can be a pretty heavy topic.
It can, yeah. So a lot of people have this kind of experience in their past. And so according to the CDC, about 1 in 6 adults experience at least 4 or more ACEs. Here's a quote from the CDC. It says that toxic stress from ACEs can change brain development and affect how the body responds to stress. ACEs are linked to chronic health problems, mental illness, and the misuse of substances in adulthood. 5 of the 10 leading causes of death can be associated with ACEs as well, which those 5 are heart disease, cancer, respiratory diseases, diabetes, and suicide. It's become clear that ACEs can dramatically affect a child far into adulthood.
Wow. So who do ACEs affect?
Well, really anyone can experience an ACE, but according to the CDC, most women and several racial, ethnic groups, minority groups were at a greater risk for having experienced 4 or more types of ACEs.
How do they affect people?
One of the recent studies done by the Tennessee Department of Health was produced by the Sycamore Institute. It revealed a lot about the economic cost of ACEs because of the health risk that they pose for those people affected by them. Over half of the adult Tennesseans report to have at least one ACE between 2014 and 2017. About 17% had experienced 4 or more of the ACEs.
Oh, wow.
In 2017, ACEs among Tennessee adults led to an estimated cost of $5.2 billion in direct medical costs and loss of productivity from employees missing work. And these costs are associated with at least 8 ACE-related health outcomes and behaviors. So among these are like cigarette smoking, which can be a $2.1 billion issue, and depression, which is $923 million issue. And those were the 2 most costly issues. So by affecting our health outcomes and behaviors, ACEs increased healthcare costs in the taxpayer-funded programs like TennCare, and they raise employer costs for healthcare and productivity loss. They shrink earnings for employees who miss work, and in the effort to prevent ACEs, they mitigate their effects that could potentially reduce those expenses.
Do most of these ACEs come from childhood, or can this really
Yes.
happen from any age?
No, it's 0 to 17. So
Okay.
pretty much any time before the age of 18, we think ACEs can happen, you know.
Okay.
So somebody whose parent gets divorced, a mentally ill, or an incarcerated family member, that kind of thing.
So what can we do about ACEs?
So our biggest hope in reducing ACEs for people is by raising awareness and having prevention. So preventing ACEs could even reduce the number of adults with depression by 44%. Preventing ACEs have the opportunity to help children and adults thrive by lowering the risk for conditions like depression, asthma, cancer, and diabetes. They can reduce risky behaviors like smoking and heavy drinking. They can improve education and job potential. They can stop ACEs from being passed from one generation to the next. So one of the specific ways that we're trying to prevent ACEs in Southwest Tennessee is throughout the Healthy Families Southwest Tennessee program. This is a home visiting program that's available for families that are pregnant or have a child less than 3 months old. After the child is 3 months old, they're already considered to be in an intervention rather than the prevention phase. So the window of opportunity is pretty small for families who want to initiate those services. And the goal of Healthy Families Southwest Tennessee is to raise awareness for our program so that more families who've been affected by ACEs have the opportunity to reverse the damages for themselves and their children as they're beginning to raise them. So one of the ways that we can increase awareness with families is by doing the ACE screening within 6 months of services. This gives us kind of like a gauge of how many ACEs they've experienced and how many risk factors they have for their child. So when we talk through ACEs, we also want to talk about PCEs with each family.
Okay, before I go into that, so what is involved with the screening process?
So we ask them the 11 questions that come with the ACE questionnaire. So we kind of fill out, this happened to me, this did not happen to me, I don't want to answer. So they have the option of saying, yes, I was sexually abused, or no, I don't want to answer that. So we score the questionnaire based on, their answers and stuff like that. So the higher the ACE score, basically they get a check mark if they've scored yes. And so the higher the ACE score is like the 4 or more, that kind of thing.
Gotcha, okay. So what are the PCEs?
So PCE stands for Positive Childhood Experiences. Christina Bethel of Johns Hopkins University, she is one of the major researchers on PCEs, and she defined positive childhood experience as feeling safe in our families to talk about emotions and things that are hard and feeling supported during the hard times. So in your childhood, the PCE asks you these kind of questions. Were you able to talk with a family member about your feelings? Did you feel that your family stood by you during difficult times? Did you enjoy participating in community traditions? Did you feel a sense of belonging in high school? Did you feel supported by your friends? Did you have at least 2 non-parent adults who took a genuine interest in you? Did you feel safe and protected by at least one adult in your home? So a child experiencing a PCE can experience them inside the home or outside the home. So these experiences do not necessarily cost a lot of money, but every child needs a place in their life where they can feel safe and they can learn to trust someone.
I feel like this all kind of ties into mental health.
Absolutely, yeah.
Which I'm glad that that's becoming more in the conversation nowadays as opposed to like 5 years ago.
Yeah, and you don't want a kid to get to college and then start analyzing their whole childhood. You'd like, especially by the time somebody's a parent, for them to kind of look back and say, hey, this is what happened to me. Do I want to repeat those same behaviors with my child?
Right.
Or do I want to, break the mold basically and, start afresh?
Yeah. Okay, so where do we go from here?
So the biggest thing we can do as a community is to continue to raise the awareness about ACEs. The Building Strong Brains program in the state of Tennessee is an ACEs initiative that's a major statewide effort to establish Tennessee as the national model for how a state can promote culture change in early childhood. So it's based on a philosophy that preventing and mitigating adverse childhood experiences and their impact is the most promising approach to helping Tennessee children that lead productive, healthy lives and ensure the future prosperity of the state. So Healthy Families Southwest Tennessee hosts the ACE grant in order to promote awareness in this community. In order for every person to have the opportunity to analyze their life, especially their own childhood, we want to help them understand who they are and where they came from. We want them to be people who know this information. We have a great opportunity to influence the next generation by creating positive childhood experiences in their lives. We all need someone we can trust and open up to, so we want to strive to be that person for somebody else.
No, it's great that you guys at Healthier Beginnings are doing that for the families
absolutely.
who don't have that. That's amazing. So there are people who know that they themselves have ACEs, or their children do, or someone that they know. Who can they contact, and where are you guys located?
We're located across the hospital, across from the hospital, off Skyline. We have an ACE community coordinator who is officing there at the Healthier Beginnings office. And so if you need more information, you can contact her at emily.sain at wth.org.
Perfect. I will include that in the description, so Emily's email might be blowing up soon, which is great.
Yeah.
So, well, thanks so much for coming in today. This has been really informative. I had no idea what an ACE was until you sent me this information, and I'm really glad that we're taking a step to get the information out there. That's great and very much needed, I think. Thanks so much for coming in today.
Hey, I appreciate you having us on. Thank
Absolutely.
you so much.
Sure thing. And this has been another episode of We Talk Health.